So let's look at a couple of examples of how climate change projections are translated to health impact projections. As we said, there are no process details that actually can go from temperature to exactly pathway to changes in health projection for the future, health impact projection. We have consistently been looking at the empirical relations, and that tends to be the baseline in any case. Here, a mean climate warming is applied to the observed present-day climate to create a temperature projection time series that can be applied to the observed present temperature mortality relationship. So that's the key. You take past data and create empirical relations between temperature and mortality, temperature and asthma, or morbidity, diarrheal diseases and water quality, temperature, water quality, diarrheal diseases, and so on and so forth, as the data allows. The degree of climate warming is calculated as the difference between the future period and the present period mean temperatures, as estimated by climate models to give a temperature anomaly. Okay, so this essentially gives you a flavor of how climate change impact on health are projected into the future. So let's look at a particular example of how detailed these projections can get. IF is a international futures model that's an integrated assessment model that produced these projections of causes of death by cause groups. You can look at the details in these in this paper. So it's looking at cause of death variation under the shared socioeconomic pathways. We mapped the phase space of the shared socioeconomic pathways. Now this paper, using an integrated assessment model, is trying to translate that into mortality by under various SSPs, as they are referred to. RCPs are representative concentration pathways, and SSPs are shared socioeconomic pathways. So here, Group 1 causes communicable diseases, diarrheal, malaria, respiratory, HIV, AIDS, and other other Group 1 causes. Group 2 causes include non-communicable diseases like malignant neoplasms, cardiovascular, digestive, chronic respiratory, diabetes, mental health, and other Group 2 causes. And Group 3 causes include injuries, road traffic accidents, other unintentional injuries, and intentional injuries like conflicts and so on. Okay, so just to jump to the results, this is showing trends in just the diarrheal diseases across the world regions for SSPs, various SSPs here. The gray shadings are for SSP 1 to 5, and the time horizons are 2030, 2050, and 2080. So real projections of health outcomes or health impacts. Remember, SSPs already have climate change impacts in them, right? So we're looking at East Asia and Pacific, Europe and Central Asia, Latin America and the Caribbean, Middle East and North Africa, South Asia, Sub-Saharan Africa, and high income countries. Just like climate models that do projections do not have very high resolution at which we wanted to do vulnerability and risks, for example, SSPs also obviously, and the integrated assessment models, don't have that kind of resolution. They can only do coarse resolution in time and space. Climate projection models can do high resolution in time, like months, seasons, and so on, whereas integrated assessment models typically do only 5-year chunks or 10-year chunks and region level projections, whereas climate projections can be on the order of 50 or 100 kilometers. Okay, then they are downscaled to local level using various other techniques like dynamic downscaling, statistical downscaling, and so on. So the main message, of course, is that these projections are made for 2030, 2050, and 2080, and there are differences in the impacts of various shared socio-economic pathways, and of course there are differences in regions as well. You have to read the details as to what assumptions create these differences, which why East Asia and Pacific is so low, for example, compared to South Asia, which includes Bangladesh, Pakistan, India, and Nepal, Sri Lanka, and so on. Sub-Saharan Africa, of course, you expect, and things don't necessarily uniformly get worse into the future either. Some of them get better, so those depend on the scenarios as well, the choices made, you can see here. And high-income countries, of course, do not change much over time or for the various social various SSPs. Okay, so obviously this is a brave attempt, but the trick is, of course, to understand the uncertainties in these projections and how uncertainties in climate change projections are translating into health impact projections. Not very easy, right, to carry forward the uncertainties. Nonetheless, investigators modeling climate change health impacts must answer a number of questions in the course of their modeling efforts, including what are the model's scope and scale, what populations will be included, will the analysis be stratified by age groups, by socioeconomics, by geography, and so on, what exposure factors will be included in the response function, how will impact be expressed? How will the model include adaptation? If so, how? How future health impacts will depend on adaptation? How will uncertainty be considered and assessed? This is very critical. How will uncertainty be considered and assessed? These are obviously become very kind of choices by modeling groups, which depend on various factors. Also, another example, looking at climate impacts on health outcomes and costs of health impacts. Okay, so this is for 2012, so it's a past, it's not projection, but this study looked at the various regions of the US with various climate events and looked at climate sensitivity of various health outcomes like mortality, morbidity, emergency department visits, health admissions, and so on and so forth, including the cost that falls on the individual, or how the healthcare system takes care of it, how daily wages are impacted, and so on and so forth. And these various data were combined to drive these models to estimate total health related costs. So one of the things you want to do for the future is to see how health costs are going to increase as well as the health impacts. Okay, so this is just something I'm using as an example. And in the US, value of a statistical life is included as well when mortality is happening. So this itself is very subjective and may depend on which part of the world you are doing this, or within the US, which part of the US you are doing this. Not all lives are the same when it comes to value of a statistical life. Okay. Nonetheless, it did the projections of health costs, medication cost, home healthcare costs, outpatient cost, hospital admission costs, wages lost, emergency department visit costs, and so on. And proportion of morbidity costs are represented here for Lyme disease, allergenic oak pollen, extreme weather, all the way to Hurricane Sandy, because each region had a different disaster. And the point is that such models are estimating the cost for a particular year, and attribution of additional costs to disasters is not always very easy. Just like an extreme event has to be attributed to climate change. For example, if a hurricane happens, hurricanes happen anyways, but how was the hurricane made worse by climate change? And then how that translated to health impacts, and how that resulted in health costs in terms of morbidity and mortality. So there are many steps which have to be worried about. Then you have to do that for the future. How will hurricanes change? How will hurricane impacts change? How will demographics change? How will sea level rise, storm surge, inundation change? And how that translates to health costs in the future. Nonetheless, this article in the Lancet puts out some ideas on how globally consistent health impact projections can be taken to the next level. So they compiled a number of studies across the globe which looked at increases in heat attributable mortality, increased exposure risk for non-cholera vibrio species, temperature attributable enteric infection mortality, reduced labor supply and productivity, transmission season increases for dengue and malaria, and of course malaria as well. So there is no choice other than to make such projections and keep trying to improve them. So improving climate projections, quantifying their uncertainty, improving climate impacts on health and that uncertainty, and then how these together will change into the future. So obviously many challenges, but it is something that continues to be improved everywhere. Data, data, data. More data on health, more data on climate, more data on attribution of climate to events. For example, the Northwest US heat wave that happened in July 2021 has now been attributed to climate change, and apparently it was made 150% more likely by climate change. So without climate change, this pretty much would not have happened, this heat wave. Okay, so that's critical. Now that has to be translated to health impacts. What additional morbidity and mortality was created by this heat wave? Right, so that has to be looked at as well. And as we said before, probability of the heat wave versus intensity of the heat wave also has to be separated in terms of climate change contributions. Okay.